Hi everyone, I'm Anna with Shameless Care. I'm thrilled you're joining us today for what is shaping up to be a truly important conversation in the realm of sexual health. The focus of today's discussion? DoxyPep. Specifically, its effectiveness in cisgender women and what the latest research is telling us. We'll be unpacking the CDC's guidelines on DoxyPep and exploring 5 recent studies, including a groundbreaking one from Japan that offers some incredibly encouraging findings. For anyone looking to reduce the recurrence of STIs, this will be an eye-opening and valuable discussion. Before we get started, I want you to know this. At Shameless Care, our mission is to empower you with the knowledge and tools you need to take control of your sexual health. No judgment, just support. First things first. What exactly is DoxyPep? If this is the first time you're hearing about it, here's a quick rundown. DoxyPep stands for doxycycline post-exposure prophylaxis. It's not used like traditional antibiotics where you follow a full course to treat an infection. Instead, DoxyPep is a single dose of doxycycline taken soon after unprotected sex, including oral sex, to significantly lower the chances of contracting bacterial STIs like gonorrhea, chlamydia, and syphilis. Now I know what you're wondering. How well does it actually work? The short answer, it's highly effective, though it doesn't completely eliminate the risk of bacterial STIs. The extent of its effectiveness can depend on several factors, which we'll explore in a bit. Here's the challenge. Most of the research about DoxyPep so far has been focused on men who have sex with men and transgender women. These are groups that are disproportionately impacted by STIs. Unfortunately, these studies have left a gap in understanding its effectiveness for cisgender women. A pretty significant gap when you consider how many people could benefit. Historically, medical research has often prioritized men, and this is another example of why inclusivity in healthcare is so critical. Up to now, there have been 3 key clinical trials involving DoxyPep that are highlighted in the CDC's guidelines, all conducted among cisgendered men and transgendered women. These studies consistently showed impressive results, reducing bacterial STIs. However, when it comes to cisgender women, results have been more limited. Only 1 previous study focused on this population, and while this study observed a reduction in STIs amongst participants, the data wasn't statistically significant, meaning the results didn't meet the strict reliability standards that scientists look for. But don't lose hope. A lack of statistical significance doesn't necessarily mean DoxyPep isn't effective for cisgender women. It may just mean we need more comprehensive studies with better adherence to the treatment protocol. Now, why were the results for cisgendered women different? Here's where things get interesting. Researchers found that adherence, or how consistent participants followed the treatment, is likely a major factor in the results for cisgendered women. Hair sample analysis revealed that 44% of participants who reported taking DoxyPep may not have taken the drug at all, meaning almost half of the participants did not adhere to the treatment schedule. The CDC guidelines even highlight this, stating that despite self-reported usage rates, only 29% of the participants in this study showed detectable levels of doxycycline. This is a major gap between reported and actual data and sheds light on why the results may not have been as promising as they could have been. If adherence had been better, it's likely the results for cisgender women would have looked very different. By the way, if you've learned something new so far, drop us a like below. It helps remind YouTube algorithms that this is the kind of content that matters. The narrative doesn't stop there. Earlier this year, a brand new study out of Japan delivered some fantastic findings about DoxyPep, or more specifically, DoxyPrep in cisgender women. Before we get into the data, here's a quick distinction for those unfamiliar with this terminology. PrEP, or PrEP, pre-exposure prophylaxis, means you're taking the medication before potential exposures. PEP, or PEP, post-exposure prophylaxis, means you're taking the medication after potential exposures. For this study, female sex workers who have more frequent occupational exposures took 100 milligrams of doxycycline daily, a regimen referred to as DoxyPrep. Here's what the researchers found. Chlamydia rates dropped by 64% from 159 to 57 cases per 100 person years. Gonorrhea fell by 61% from 55.9 to 22 cases per 100 person years. Syphilis from 17 per 100 person years to 0. Yes, 0. Even better, there were no negative impacts on vaginal health. No increases in bacterial vaginosis or yeast infections were observed, which is often a concern tied to antibiotic use. Currently, the CDC's DoxyPep guidelines focus on men who have sex with men and transgender women, populations deemed high risk for bacterial STIs. However, I believe we need to start tailoring these decisions to individual needs rather than broad categories of people. Bacterial STIs affect cisgender women in significant numbers with serious health consequences like pelvic inflammatory disease, infertility, and pregnancy complications. For cisgender women at higher risk, whether due to multiple partners, prior STI diagnoses, or other factors, DoxyPep might be worth discussing with a healthcare provider. And remember, Shameless Care makes this simple and convenient. You can connect with a medical provider right from the comfort of your home. No waiting rooms required. Of course, there are still crucial questions to answer. One major concern surrounding DoxyPep is the potential for antibiotic resistance. The good news? Researchers are actively monitoring resistance trends and updating the guidelines as needed. There's a lot more to learn, and the conversation doesn't end here. At Shameless Care, we're dedicated to keeping you informed about sexual health innovations like DoxyPep. Don't forget to subscribe to our channel for updates like this and other essential topics. Thank you so much for spending time with me today. I'm Anna, and it's truly been a pleasure sharing this information with you. If you have any questions or comments, drop them below and check out our other videos for even more must-know content. Until next time, take care of yourself. You deserve it.